Go to the Natural History Museum, look at the skull of one of our ancestors. Their teeth are pristine. There's no cavities, big wide jaws, room for the wisdom teeth, but no cavities. I mean, you would think without dentists and toothpaste, they should be just rampant. So what has changed? We started to notice decay in humans around the agricultural revolution, and then even more so around the industrialized revolution. So when we left from hunter-gatherer societies to agrarian, and then we started milling and processing and adding all these additives and flours and sugars and everything to our foods, cavities skyrocketed. I think it's also important for people to think of the mouth as the beginning of the gut. And so you cannot have a healthy gut without a healthy mouth.
Toothpaste, like what should people be looking at when they're looking at ingredients? What's on the no list? What's on the yes list?
Yeah.
Dr. Staci Whitman, you're here in the flesh.
Yes.
Came out for little old me.
Yeah, I did.
Thank you.
It's an honor.
So you're on the West Coast. You flew out here to the middle of nowhere. Have you been to Pennsylvania before? I've
driven through for like spring break trips down to like Key West.
Okay.
You know, that type of thing.
Yeah, because you're from Maine.
I'm from New England.
Yeah. So yeah, we passed through it. So we're not like a destination for people in New England. We're just
I think I've hung out in Philly before.
Okay.
I believe.
But
never Pittsburgh.
But it's okay.
Yeah, sorry.
Yeah. So you hung out in Philadelphia, but you never made it this far.
I haven't, but it's beautiful.
It is.
Especially out here.
Yeah.
Yeah.
Pennsylvania is funny. If you're not from Pennsylvania, and there's all these P's, Pennsylvania, Pittsburgh, Philadelphia. My wife's from LA. A lot of people in LA, they just assume it's Philadelphia. Like Pennsylvania is Philadelphia.
That's all it is.
Yeah.
Interesting.
And I think the P's are confusing America.
Maybe.
So I'm in, if I had a side hustle, it would be educating people about Pennsylvania.
We can do it right now. What great opportunity.
Yeah.
Yes, we are educating you.
And I will say it's culturally, not that you're asked this, but Pittsburgh is more culturally Ohio, West Virginia, sort of Rust Belt.
Okay.
Philadelphia is more
urban,
more East Coast,
New
York.
Yeah. That was my experience. That's the crew I was hanging with, was like the New York crew.
New York
in
energy
Philly.
is in Philadelphia, in my opinion. People in Philly may disagree, but I would say we are more like Midwestern, Southern type Rust Belt people. That's what I would say.
Well, I love it, and everyone should come visit Pittsburgh, Pennsylvania.
This episode has been sponsored by the Pennsylvania Board of Tourism. Just kidding, it's not. All right, so let's get here what we're supposed to be, what we're here to talk about. I am such a fan of your work. I'd like to maybe define some terms for people. They hear dentistry and they hear biologic dentistry or biological dentistry that we've talked about in the pod before. And then we have functional dentistry. Can you, for people that haven't maybe listened to past episodes, define what biological dentistry is for people that don't know, and then this sort of offshoot or Venn diagram, some similarities, but some distinct differences of functional dentistry. Break it down.
Yes, it gets confusing because you'll also hear holistic dentistry and integrative dentistry. And it's very similar to how you hear functional medicine and integrative medicine, et cetera, right? So it's very nuanced, and I will just applaud any dentist that's thinking outside of the box and trying to connect the dots more. But to me, biological dentistry is really looking at the systems biology and trying to maintain the biology of the oral cavity and teeth. So there's a lot of discussion there about root canals, avoiding mercury fillings and toxins and things of that nature. Functional dentistry is really based on the principles of functional medicine. And so you need that underlying functional medicine training. So I would think of functional dentists more like dental physicians, in the sense that we're really trying to connect the dots through data and understanding how the systems work. So hormone pathways and immune health and, GI mapping and cardiometabolic and environmental toxins and gene SNPs, and really trying to unpack all those things we weren't taught in dental school, because unfortunately medicine went this way, dentistry went this way. So the mouth is just floating over here separately in many people's minds, but it's all connected. And so what happens in the mouth is going to impact things downstream, like inflammation and, biomarkers and things of this nature. And so it just takes a lot of extra training. And so I think it would be more like a functional medicine experience, but focused with a focus on oral health.
Got it. So the similarities, I guess, of biological dentistry with functional dentistry is sort of some of the root causes when you look at pathogens and root canals and this, but it's mainly centered around the mouth with biological dentistry versus sort of the next level would be, yes, that is true, but there's a larger, it doesn't just happen. It's not just about cavitations and root canals.
Correct.
It's more than that. When you look at the larger microbiome and hormones, you mentioned these other variables. I guess that's a good follow-up question. Like, what are some reasons why, like, what are the connections? What's the hormone mouth connection? Why should people know about that and what's going on there?
Yeah, well, inflammation, number one. So inflammation will impact hormone pathways.
Certainly.
And, stress, certainly cortisol, that impacts our salivary health, that impacts our gum health. You'll have gum inflammation. For women's health, this is incredibly important when we look at perimenopause and menopause and pregnancy. Unfortunately, so many women are just, pushed to the side saying, oh, your issues are in your mind, your teeth are shifting, or maybe you're clenching more, TMJ, TMD issues, things like that can all be traced back to hormonal changes.
Yeah.
Fertility issues as well. We're seeing a lot of fertility challenges because of dysbiosis in the oral microbiome. And we can dig into this a little bit more. And then with men as well, it can impact, hormones impact sperm mobility, sperm motility. We're finding that oral pathogens can impact all of those hormone pathways as well. But instead of just talking about it, sometimes it's important to know how to read and interpret these labs so that you can discuss these findings with medical providers, because unfortunately, not everyone's looking at it this way and through this lens. And so it's a bit of a movement that we're trying to work toward. But ultimately, I think finding any dentist that's at least just talking about beyond the mouth, and that the mouth is the gateway to the body and the mouth is where health starts. I think it's also important for people to think of the mouth as the beginning of the gut. And I think when we have that mindset shift, we just treat it with a lot more respect. We're so focused on gut health, but it's incredibly important to know it's bidirectional. And so you cannot have a healthy gut without a healthy mouth. And so I'd like more functional medicine doctors, but also dentists thinking of it that way too.
Well said. So let's go dial it into something that you said that I think got probably a lot of people's ears ringing, is the fertility component, whether it's sperm motility or other pathogens that can impact fertility in women. What's the science say there?
Yeah, so studies show that if you have gum disease, and about 80% of the population has gingivitis or gum disease, that's when your gums are puffy, inflamed, bleeding. This is inflammation. It doesn't just stay in the body. So that inflammation can impact fertility outcomes, as well as the oral pathogens that are associated with gum disease. So when you have bleeding gums, those pathogens can get now through your gum tissue into your circulatory system, and they float around. They end up in places they shouldn't, like potentially your uterus or your ovaries, et cetera, and they can cause inflammation. So the studies are showing that women and men who have gum disease, it can take 2 months longer to conceive. Obviously, more studies are coming out, but they find once the couple goes in and has oral health rehabilitation, so cleanings, they focus on lowering the pathogens, increasing microbial diversity, that then fertility outcomes improve. And so wouldn't it be amazing if fertility clinics were discussing this and maybe testing the oral microbiome to see, are there key pathogens that are impacting a couple's ability to conceive? So it's just taking a step back and looking at the broader picture and certainly focusing on microbes. And I think there's a big movement in medicine and dentistry, and it's exciting.
Yeah, it is. So you mentioned some telltale signs of someone's like, okay, do I have gum problems? Do I have gum inflammation? You mentioned inflamed gums, bleeding gums. So for people that floss and there's some blood there, is that what we're talking about, eliciting blood? At what point are you like, how would somebody know?
Yeah,
I guess.
Great. Generally, pink in the sink. Your gums really shouldn't bleed. Now, some people might have just a spot here or there. And usually that is from, there's an issue. So maybe you're filling isn't well adapted. So it's creating low-grade inflammation, or it's just the way your teeth are shaped or rotated due to like an orthodontic issue. But ideally, gums should be pink and firm and not bleed. They shouldn't be tender. They shouldn't be puffy, bulbous, red. I mean, all those signs of inflammation, right?
Mm-hmm.
And knowing that inflammation, it can travel. Like, it's just not going to stay in the mouth. But also, I think people don't realize gum disease, gingivitis, can be a nutritional deficiency issue. Vitamin D deficiency, zinc, B vitamins, vitamin C, scurvy. Okay. So we need to dig deeper. And this is functional dentistry also. So instead of me just shaming a patient saying, you're not flossing enough.
Right.
And they say, I floss 3 times a day. Then we dig deeper and we say, well, gosh, tell me about your diet. Are you getting enough collagen? Do you get enough protein? What is your vitamin C status? What's your vitamin D, right? Magnesium, all of these deficiencies that we know can impact so many different systems in the body. They impact oral health too. Yeah.
Okay, so these pathogens, these opportunistic or pathogenic bacteria, let's go over it. Like, what does science show to be the gnarly guys, what's really messing up people's oral microbiome and in turn larger systemic problems?
Yeah, there's a complex. It's called the red complex. It's the biggest offenders, and there's different oral microbial analysis that will test just for these. They're usually associated with periodontal disease. So you start with gum disease, and that's when your gums bleed and are inflamed. But eventually, that will lead to periodontal disease, which is when we have more of a chronic systemic inflammation, and you lose bone around your teeth. And so P. gingivalis is a big one. That is associated with dementia and Alzheimer's disease specifically. F. nucleatum is one that's associated with colon cancer and pancreatic cancer. T. denticola is one that impacts fertility. So again, this is where functional dentists may have a little more knowledge. If you do salivary analysis, I mean, that's the problem with testing, right? You get the results and you say, great,
what do I do with
now
this?
What do I do with this? And to be very honest, like, we're still working on protocols. Like, this is very new. What we're discussing right now is cutting edge science, and the studies are being focused on this. And so we're working on protocols. How does this bacteria interact with that one? Is there a synergistic representation in the mouth, which a lot of times they gang up together and cause
little
more
gangs. Little bacterial colony-forming gangs.
Yeah, but knowledge is power, you know? And so I like to share this example. I have a good friend, and overall, her oral health is wonderful. She's a dentist, actually. But we did oral microbiome testing on each other, and she was through the roof for F. nucleatum. That is very linked to colorectal cancer and pancreatic cancer. How would she have known if she hadn't tested? Yeah. And so this is the whole idea. You want to catch issues decades before we start seeing symptoms and signs. So I do love everyone to oral microbiome test. I would love functional medicine providers to be considering adding it to their workup on patients too, because especially if you're focusing on gut health, you know, we swallow 2,000 times a day. Where's that bacteria in the mouth going? It's going to impact the gut. And we know it does, and other systems downstream. So we really need to work together, functional medicine and dentists, to try to really optimize patients.
Yeah, well said. Is there a specific, and obviously there's always new diagnostic medicine advancements every year, but at this point, is there an oral microbiome test you like better than others?
Yeah, there's a few out there. So the one I like is generally direct to consumers. Dentists are using it too, but I like people to have the power, because otherwise it's really hard to find providers offering these services. So it's called Bristle. It uses shotgun metagenomics, and it's basically giving you your whole DNA analysis, all the bacteria, fungi, protozoa, viruses. It will look for yeast, which is a big culprit in oral health issues that not enough dentists are looking into. So that's when I like direct to consumer. A really common one many biological dentists and functional dentists will use at their offices is called oral DNA. And they really focus on periodontal pathogens, kind of the top 12 most villainous culprits. And that's a great place to start as well. And they give really great criteria, protocols. Like, a lot of times you need antibiotics. We have to be open to this, right? Some of these are really virulent and quite gnarly. So sometimes we need to throw a lot at it. So I suggest be open-minded.
Yeah. So you mentioned the candida, and people obviously maybe have heard of thrush as being sort of the overt sort of manifestation of that. But I'm assuming it exists on a spectrum, right? I mean, so what do you see clinically with patients?
Yes. So I work mostly with kids. I'm pediatrics. So we do know that we used to always blame Streptococcus mutans, specifically. That's a bacteria for cavities. I think it's important to know cavities are the #1 chronic disease globally in children and adults, and nearly 100% preventable. And we've just accepted this as normal because so many of us have had cavities and dental issues, but humans were not meant to have our teeth degrade and dissolve like this. And if you look ancestrally, just 10,000, 12,000 years ago, which is nothing, if you look at a skull, go to the Natural History Museum, look at the skull of one of our ancestors, their teeth are pristine. There's no cavities, big wide jaws, room for the wisdom teeth, but no cavities. I mean, you would think without dentists and toothpaste, they should be just rampant. So what has changed? We started to notice decay in humans around the agricultural revolution, and then even more so around the industrialized revolution. So when we left from hunter-gatherer societies to agrarian, and then we started milling and processing and adding all these additives and flours and sugars and everything to our foods, cavities skyrocketed. So circling back, Streptococcus mutans was always blamed for that. But we know now Candida is synergistic and opportunistic and works alongside strep mutans. And so with children, we're seeing rampant decay in 1-year-olds, 18-month-olds, 2-year-olds. And I'm sure there's parents out there listening saying, yes, this is my experience. We've done everything correctly. And now my child has to undergo anesthesia for dental issues. And a lot of times it could have been Candida exposure. So it's just something to be aware of. And instead, unfortunately, many of my colleagues there's a blame and shame. And they're saying, what are you feeding your child? It's your breast milk. You have to stop breastfeeding, which that really makes me upset.
But doctors say that
all the time.
Wow.
Dentists and doctors constantly will tell moms to stop breastfeeding.
Saying the breast milk's giving the cavities.
Yes. They're missing the root cause issue. It's not the breast milk. It's either the teeth are mineral devoid. So mineral deficiencies in teeth is a silent epidemic that I would love to yell from the rooftop. So thanks for this opportunity to share this. But I'm seeing more and more children being born with hypoplastic or undermineralized enamel. That means their enamel can't even protect their teeth like it's supposed to. Our enamel is supposed to be the strongest substance in our body. It acts like an armor to protect from acid attacks. These kids don't even have appropriately formed enamel. And then you add in, pathogens, like our oral microbiomes are shifting, our gut microbiomes are shifting, environmental toxins that we're being exposed to. But instead of all of those conversations, the mom's breast milk gets blamed, And so it's very frustrating. It's really hard for moms to be blamed for something that is out of their control. So that's why I just say, try to work with providers that support you. And please breastfeed. It's the best thing for your baby.
Yeah.
Not only nutritionally, but for immune health and coping and bonding and neurosensory feedback, but also for airway development. So breastfeeding helps develop the face and the palate and the airway. And that's part of functional dentistry too, is really talking about sleep and breathing and airway health.
Oh, this is so fascinating, Staci. Okay, so some of these dental issues, because of the health of humans today and modernity, it's happening in utero. You're saying the babies are born with some disadvantage many times. And like you said, breastfeeding is probably one of the better things to at least move the needle in the positive direction, right? Not
seed oil filled formula with all these other additives that's made with fluoridated water.
Yeah. Oh my gosh, we're gonna go all in the fluoride. Don't worry about that, people. Okay. So I guess before we move on, well, you know what? I'll put it we'll talk about it at the end. Let's jump into fluoride in water. People are seeing it in the press, in the media. We've known in our space, like it's associated with lower IQ. It's associated with thyroid issues. It's associated with melatonin and sleep disturbances. Yeah. But it's controversial. It's quite a hot button topic. We sound we're kind of relegated to this sort of conspiracy theorists when it comes to
the woo-woo caucus.
The woo-woo caucus, yes. right. Proud member. So can we talk about just the history of why do we do mass fluoride in water?
Yeah. So the history of water fluoridation was based on observation. So in the early 1900s, there was a dentist in Colorado Springs who noticed that his patients' teeth, although mottled and they didn't look attractive, they were awfully strong and seemed very resilient to acid attacks, and they didn't have cavities. So he wondered why. His intentions were very good, I believe. He was just curious. And so he looked at the water supply in their city, and it was, or town, I should say, it was a small town at that point, and it was very high in fluoride. And so this kind of spread. And not much research was done whatsoever before it was put in the water supply of Grand Rapids, Michigan in the 1940s. So there were never any long-term safety studies. And the one efficacy study that was done, it was abandoned. I think it was supposed to be 15 years, and it only went on for 5 or 7 years because they said, good enough, because they saw cavity rates going down. Okay, but they never looked at what this extremely electronegative, ion on the periodic table that reacts with other organ systems and et cetera does. So now flash forward, it was very controversial even then. That's what's really important to know. In fact, many dentists were concerned with it. Certainly endocrinologists, biochemists, anyone that understands this element and what it can do were concerned. So here we are, we're fluoridated. We are one of the last countries to fluoridate our water. Only 97% of the world, 97% of the world does not. Okay, so that's really important to know. And many countries were fluoridating, but they've since removed it or banned it. And so why is that? What is it really doing? So many of us have had concerns, as you mentioned. I like to share this story. I was trained as a traditional dentist, and I actually was super pro-fluoride. I used to say everyone needs it. Portland, Oregon, where I'm from, is not fluoridated. It was on the ballot in 2012. I was on the pro-fluoridation side. I was picketing, handing out buttons. There was like a saying, say F yeah. It was like F minus for fluoride. It's ridiculous.
Little chemistry nerd.
Yeah.
Slogan.
Totally. And I had a t-shirt. I mean, it's like, I have to be honest about this.
Yeah.
And so I remember sitting in a debate, the pro versus anti, and I don't like those terms, but just so you understand. And I was sitting there mad and fuming, kind of saying woo-woo caucus, like pointing at the people who had concerns with water fluoridation. And I was judging them and saying they're ruining public health. And I listened to the debate. I actually listened. And so many things came up I had never been exposed to. They do not teach us this in dental school. The concerns with neurocognition, with endocrine disruption, with gut health. What is it doing to the gut microbiome? Fluoride is extremely antimicrobial. Okay, so what is that doing? So I had to take a pause. And I mean, it was hard. And I went to my home, and I remember I just devoured NIH and PubMed and Google Scholar. And it doesn't take long to just read a couple studies to at least raise an eyebrow and say, what are we doing? Around this time too, they're teaching now in dental schools that fluoride works mostly topically, not systemically. So its impacts and effects are topical in nature. That means toothpaste, rinses, the varnishes at the office. We do not need to be ingesting it. Plus, it's a medical ethical issue. Patients should have consent. It's a choice. We are supposed to screen patients for their cavity risk to decide if they need fluoride or not. And clearly, we're not doing that by mass medicating people. We also, you can't, it's really hard to titrate and calculate how much someone's exposed to. So, we fluoridate here in this country at 0.7 milligrams per liter. Well, do you drink 1 liter of water a day, Dr. Cole, or do you drink more?
Yeah.
The American Academy of Pediatrics wants pregnant women drinking 3 liters of water a day. So are we limiting water in pregnant women? Because we're seeing at even 0.7 milligrams per liter, a lot of the studies say around 1.2 milligrams per liter, there are concerns with IQ drops and et cetera, all the things. So it gets it gets heated, and I don't understand why. I just wish we could take a breath and not attach so much emotion to it. We know countries, so based on World Health Organization data, countries that fluoridate have the same decay rate as countries that do not. And so when we added fluoride to the water back in the 1940s, maybe it did have an impact, but also maybe it was observational. Maybe we were getting better about educating patients on brushing and flossing and seeing the dentist. And there are a lot of studies to show that trend was already happening.
Right. Causation versus correlation.
Exactly. Yes. So this past year was very exciting because we've been waiting and waiting. There was the TASCA trial, which is basically, it was a federal trial, the people versus the EPA, and it's been going on for almost 7 years. And we finally got the ruling. And the ruling came in after a National Toxicology Program report came out. So this was in August 2024. And that report we'd also been waiting on for years and years. And it was only released under Freedom of Information Act by the judge of this federal trial. And it said, based on current water fluoridation practices, there are statistically significant IQ reduction in risks based on all the studies. And they looked at all the research, and they found at least 18 extremely high quality studies showing this causation and correlation. So it's actually both now based on the studies. And then the judge ended up ruling there's an unreasonable risk based on current fluoridation practices. And he looked at the EPA and said, you haven't been regulating this appropriately. You need to do something. Well, we now know the EPA is probably going to appeal. We shall see. Other things to know, the Cochrane Collaborative report came out a few months ago. That is the gold standard of looking at medical research and data to say, is a medical system implementation protocol reasonable? So they looked at the data and said, oh, actually, water fluoridation doesn't work as well as we thought. You're going to see this number 20, it reduces cavities by 25%. That is inaccurate. That is not correct data. So the Cochrane Collaborative showed that water fluoridation only reduces cavities by 1/4 cavity per person. That is not statistically significant. The other thing to know is that dentists are trained to fix teeth. Like, I could go in and fix 1/4 of a cavity in a human. I cannot fix a developing brain. We have one shot at developing a brain. Those first 1,000 days are incredibly important. What are we doing? You know, and then people say, well, you can just filter your water or drink bottled water. Many people can't afford that. Many people can't afford fancy reverse osmosis systems or bottled water. You know, and some moms can't breastfeed, so they do have to use formula. What are they mixing that with? And that's the halo effect. How are we calculating our exposures? People don't realize there's also fluoride in pharmaceuticals. Many of our prescription meds have fluoride in them. Many of our ultra-processed foods have fluoride in them. Anything made at a factory with water probably has fluoride in it. They're not filtering this water.
Right.
You know, it is naturally found in teas and certain, you know, vegetables and fruit. So it's a cumulative effect that we can't calculate. And so what is the easiest thing to do? Just stop fluoridating the water. Allow patients the choice to use fluoride toothpaste if they want, and actually start talking about the real root cause issue, which is our food system. No one gets cavities from lack of fluoride. We're not fluoride deficient. I have plenty of patients in my practice who do not use it. I personally do not. Teeth are pristine because of our dietary choices. This is all about diet and how we're breathing and our microbiome. This isn't about a pharmaceutical agent being used to kind of mask the underlying issue. And I get the public health concern, and I think everyone has good intentions, but we have to stop relying on these Band-Aid approaches. We have to have these hard conversations.
Oh my gosh. I have never heard someone say it so eloquently as that. So thank you. Everybody go back and listen to it and share this episode because it's powerful.
If I can add one more thing, there's another meta-analysis out. This just came out last month from the JAMA Pediatrics, which further supported the NTP report that just said, yes, there is enough data now to say there are IQ concerns with current fluoridation practices. And also, you're going to hear the American Dental Association and the American Academy of Pediatrics push back and say the science isn't valid or every excuse in the book. Try to listen to the other side. That's just like what I had to do. Okay. They have a lot on the line here. And look at these studies. I mean, look at the NTP report, read the TASCA trial. You can read the whole outline of the testimonies and everything. This meta-analysis from JAMA Pediatrics, it's sort of like at what point, how much more information do we need to at least say that this is something we should be re-examining?
Why do you think the American Dental Association and similar bodies of, academics and doctors, why would they... There's a lot on the line. It's because they would have to admit that they were advocating something wrong for decades?
I think so. I get asked this a lot. I don't know the answer. I can give you my opinion. So, yes, I think it's really hard when you've attached your identity to something, and they have been huge proponents of water fluoridation for decades and decades. I mean, it is their brand identity.
Right.
So then to say they got it wrong, and then they have to say that to all the dentists out there, and
how they've been trained.
Yes. Yeah. And I mean the pushback, but also there's money. I mean, we're talking money. The ADA is not a nonprofit. I mean, it gets money from 3M and Henry Schein and Colgate Palmolive. These are all huge fluoride.
Big Chem.
Yeah, they make fluoride products, you know. So I hate to be cynical, but follow the money. I think they're worried about litigation too. I mean, rightfully so. We're a litigious country, so if you have this data, and they did 7, 8, 10, 15 years ago that said there could be neurocognitive issues from water fluoridation, you continue to do it. Yikes.
Yeah. And there's, like you said, there's no informed consent.
Right.
We're all thinking it's water, right? It's water. It's benign. These are really good questions to ask.
Yes.
Do you think that mass fluoridation will stop? Are you hopeful that it will stop?
I'm hopeful it will. We're such a hard country that I don't know if it will. It might go state by state, community by community. There's a big push by many communities, though. I mean, there are communities all around the country right now removing it. So you have power. If you're interested out there, reach out to your water bureau, be an advocate for yourself. We'll see. We'll see what happens out there. And
I feel like something like similar to red dye 3 and these type of measures, where it's like, I feel like of California, like the 5th largest economy in the world is the state. I feel like that might be a good way. I don't even know if there's any measures in California. I'm sure there are.
It's coming. It's all coming. Florida is the state to look at right now. They are just taking out fluoride left and right.
Got it. So there are states already looking to do this.
Oh, yes. I'm involved in some of the education aspect. They asked me to come speak.
So Florida's leading the way in this.
They really do seem to be, yeah.
Wow.
Yeah.
Interesting.
Yeah.
Are there any specific voices that are leading within Florida?
Well, the Fluoride Action Network is really an amazing resource. I encourage everyone who's interested in this topic to go to their website. And Michael Conant is the attorney that was working on this TASCA trial. So he's very involved. Okay. So I'd say those are the big involves. And then, of course, RFK is talking about it too, bringing some attention to it. Mixed media, representation of it. I've been interviewed by a lot of big syndicates and thought the interview went great, and then ended up reading what was said and it was just spun, or all these important data points are excluded. So
cherry picked, suppressed information to spin a certain narrative. Yeah, it's the same playbook, right? With all different spaces within healthcare.
The last thing I'll add, water fluoridation too, you'll hear this 0.7 milligrams per liter and it's safe at that level. Okay, again, how do we titrate that? So I have been privileged enough to receive the information because of my education lecturing on this topic of seeing data points of many communities' actual fluoride levels. They're all over the place, you guys. So I've seen them as high as 2.2 milligrams per liter or as low as like 0.2 milligrams per liter. They're just all over the place. It's really hard to make sure you're hitting that exact target. The other thing to know, there are no long-term efficacy studies too. And that's what the Cochrane report said. So it's just like, why are we doing it? We're just holding on to this thing thinking we need it. Yeah. And we do not.
Yeah. So well said. Okay. So in lieu of removing mass fluoridation in our public water system, what are some things people can do right now to mitigate this sort of huge variable exposure?
I mean, if you can filter your water, that's my best advice for you. There's a lot of great brands now. Reverse osmosis does seem to be the best, but there's a lot of under the sink units or pitchers and things that you can use. There's some preliminary studies about taking iodine. It could actually help bind the fluoride. So just look into that. I know doctors using that as part of protocols. I'm not a big bottled water fan. Oh, the thing with the bottled water that upsets me too is the microplastic exposure, which going back to hypoplastic or undermineralized enamel, there's studies now showing that microplastics, they impact endocrine, their endocrine disruption.
Yeah.
And amelogenesis is a hormone-driven process. So microplastics can be contributing to the mineral issues in our kids too.
Yeah.
So
if you had to go for bottled water, go for glass.
Glass, ideally. But I mean, again, this is where it's not feasible for people. Many people can't afford that. So, but yes, filter your water, bottled water if you can. And then if you have concerns, I mean, speak up. That's what I would recommend.
Okay. Let's go to these. We talked about this mouth garden, like we have the other end of the gut garden with these different opportunistic pathogenic bacteria and yeast and fungus. What are some ways to support our oral microbiome? What's your favorite ways?
Yeah. Food.
Okay. So what are we missing specifically for oral microbiome health that's been shown to be really supportive of it?
I think we're not eating enough prebiotic fiber, so it's the same with the gut. That's why in my office, I have Eat the Rainbow all over the place for the kids, and trying to teach them how each color of the rainbow is doing something different in their body. But I would say really trying to just eat a wide array of polyphenols and all those bright, colorful vegetables and naturally fermented foods too. Okay, so your ferments are important. It's all what's on your fork. So, those ultra processed foods, this is something people aren't speaking about with like red food dyes and the BHT and the additives. What is it doing to the microbiome? And I will tell you, the kids that come in my office that consume a lot of that, their plaque looks different. Their mouths look different. They definitely have a biofilm that is altered and different. And I'd love to see more research.
Yeah, me too.
Exploring that as well. This goes back to the fluoride thing too. Fluoride's antimicrobial. What is it doing to the oral microbiome and the gut microbiome? We need studies there too. So what you put on your fork matters. How you breathe matters too. So people who mouth breathe will have a more dysbiotic or disrupted microbiome, as well as all the other health issues that come with it. So really work with an airway trained dentist to ensure that you're breathing through your nose throughout the day and at night. There's different strategies for that. It depends what the issue is. But some people, if approved and you've been screened, you can lip tape or mouth tape or sleep tape. That's kind of literally a Band-Aid to help.
I do it. Not every night, but I've made it a practice. We recommend it to telehealth patients. So it's a little bit weird for people that haven't done it before. I don't think it's weird anymore, but people are freaked out. They're like, what are you doing? What are you telling me to do?
I do it every night and will for the rest of my life because it makes me feel so good.
Yeah. So I've seen a game changer in sleep scores, REM, deep sleep.
Yes, me too.
And you're seeing similarly with dental health too.
Yes.
So what's going on there? Why is it so important?
So from a dental health perspective, when you breathe through your mouth, the pH lowers. So the pH becomes acidic. We know acidity is no bueno. That is what causes oral disease, gum disease, cavities. It will dry the mouth out too. So I don't think people realize how important your saliva is. Your saliva is this golden elixir of your body. And if you don't have it, you will have just major dental issues. And we see this with cancer patients undergoing radiation and chemotherapy. Once you lose your spit, I mean, you can't digest your food, swallowing, all of that becomes challenging, but your teeth will really dissolve quickly too.
Yeah.
So those are the main things. Patients will report more tonsil stones, more halitosis. That's all signs of dysbiosis too, if you're mouth breathing. So we want the mouth to stay moist and it needs to stay wet. And that's just the way the mouth needs to be. And so if it's dry and we've lost our salivary health, which has a lot of immune cells and enzymes in it to protect us, plus it has all those minerals, calcium, phosphorus, hydroxyapatite to naturally remineralize our teeth, you will have issues. So it's not just about cardiovascular health. and brain fog and sleep scores. So it's incredibly important, but it just goes to show you it's all tied together.
All tied together. Okay, so mouth taping. You mentioned being pre-screened. Like, is there someone that shouldn't use mouth tape?
Yeah, generally a quick test is, and this is data backed, is to make sure you can breathe through your nose for 3 to 4 minutes without feeling panicked. So if you start to feel sympathetic, panicked, you likely have some sort of obstruction. You have a deviated septum, enlarged nasal turbinates, just something going on structurally. So you should just not willy-nilly tape. But if you can put it on and breathe through your nose, then it's really just making sure you're comfortable with it. But it is, especially with kids, I don't recommend doing it until kids are at least 3 years old or above. And definitely I want you working with an airway trained dentist who says, yes, this is the best thing for your child. And it has to be well explained too, of course.
Really good. I love the nuance there. So, all right, any supplements, any other therapies or tools that you love for shifting this oral microbiome?
Well, yeah, I mean, just saying optimize in all nutrients. So we know many people are vitamin D3 and K2 deficient. That helps tremendously with oral health. Many people are magnesium deficient. That's going to help with oral health and sleep health. So I like a magnesium blend, to hit all the key magnesiums, and magnesium's a hot topic. So I think people know a lot about that. I do like prebiotic supplements if needed. Omni One is the new one that just came out that we have a mutual friend who launched it. But, we don't get enough every day. Even myself, who I try really hard to hit all my marks, I know I'm missing some days. So it's just nice to have a go-to supplement that might have these prebiotic fibers and adaptogens and things that we need. Probiotics, yes, I like gut probiotics, and I do like oral probiotics, but I think, and I'm sure you've experienced this too, we just kind of are blanketly treating people, and this is where I'm excited for more research. That
more targeted.
Yeah, more targeted
therapies,
individualized treatment plans, because a generic probiotic may work in one person, but may not in another. It could potentially make things worse, you know? So.
Yeah. Okay, this is wonderful. All right, let's talk about toothpaste. Like what should people be looking at when they're looking at ingredients? What's on the no list? What's on the yes list?
Yeah. Always personal choice. I would say the no list, though, are sodium lauryl sulfate, emulsifiers, surfactants, artificial dyes, anything sparkly. Are there plastic microbeads in there? That's a hard no.
That was a thing, and that probably still is a thing, right? Sparkly toothpaste.
It definitely was a thing.
I remember growing up, and it was like, okay.
No, I used to brush with it. But the microbeads were getting caught down in people's gingival sulcuses. We're insane.
We are insane as a human race.
I know. Just to sell more because it's prettier.
Yeah. Okay, so no sparkles. That's a good starting rule.
Just cleaner ingredients. I want people looking at their oral healthcare products like they do their food. Okay. So less is more,
And you mentioned this sort of informed consent choice, fluoride or no fluoride.
Yes.
So what's your take on fluoride versus something like hydroxyapatite for people that haven't heard of that?
I'm pro hydroxyapatite because it's biomimetic. So your teeth are made of hydroxyapatite. There's hydroxyapatite floating around your saliva. So that's why I'm a fan of it. It is also going to be more oral microbiome supportive because it isn't antimicrobial like fluoride is. Okay. I'm open when my patients come in, they're using fluoride. There's no judgment or shame. But if they want to ask me about my thoughts and my take, I usually will talk about hydroxyapatite and encourage them to read more about it. It is not new. Many people think it's new. Hydroxyapatite in toothpaste was first started in the 1970s. And then Japan caught wind of it and grabbed the patent for it in the early 80s. So it's been around a while. And there's a lot of data, a lot of safety data. Japan is very strict with these things. South Korea uses it primarily too, as well as Italy, a lot of European countries as well. And then it was newer to the United States kind of in the mid 2010. So like 2015, it kind of really blew up here. Some dentists will still bash it and poo-poo it. They just haven't seen the data or the studies. The efficacy studies are incredible. It works as well as fluoride. Some studies show it's working better. Again, it's biomimetic. Personally, this is anecdotal, but I see a lot of patients. I see almost 250 children a week, and I'm nearing my 20th year of career. Their teeth get healthier. their mouths get healthier. I mean, we see a shift in gum health, salivary health. Their teeth just look stronger. We're arresting or reversing decay in kids, which is great. We're avoiding a lot of unnecessary dental treatments and sedations and anesthesias. Not always. Like, this isn't a slam dunk for everybody, but I've seen a much bigger shift than when patients use fluoride. And I think it's because of that antimicrobial nature, personally.
Yeah. What do you think about xylitol? You see that in a lot of natural toothpaste brands.
I'm very pro xylitol. I know there's some mixed information out there. One study in particular that was floating around was pretty heavily debunked by people like Peter Attia and others. Our bodies naturally make xylitol. The methods and materials of that study was flawed. So I'm a big fan. There's just thousands of research papers to show its benefit.
Biofilm
modulator. Yep. It acts almost like a prebiotic. So it will modulate the biofilm, make it less sticky. So it's really used. If in the right concentrations, it's like an extra prebiotic.
Yeah. And like you said, a lot of people have these opportunistic, like unhealthy biofilms, which is, for people that don't know, can you define biofilms? We're talking about it, but.
Yeah, in your mouth, think of it like your plaque. It's the bacterial layer. So, and it can be made up of good and bad bacteria, but the pathogenic bacteria will often like protect itself and it can be really hard to treat. Now, the cool thing with the mouth is we can very easily access our biofilm. Yeah. How wonderful. But when you have really thick, sticky plaque, that's not ideal. Like, personally, maybe this is TMI, but I eat more paleo. I tend not to get a lot of plaque. When I grab the muffin or the piece of cake, just because I'm human, I immediately will notice a shift in my plaque on my teeth. And I think it's really gross, know, but I just don't eat a lot of those things. So if you're constantly eating those things, I bet you have a very thick biofilm or plaque. Yeah. And that's what we want to target and shift and modulate to be less sticky, less invasive. And that's where some of these prebiotics can come in.
Yeah. So is your biofilm thick or not? That's the question, guys.
I have kids coming in with bright orange plaque, and it's from like Doritos and Cheetos and stuff.
They have a Dorito colored biofilm.
Any dental hygienist or dentist out there is shaking their head yes right now. Yes, immediately. It's like Cheeto biofilm.
No.
Yes.
Humans weren't supposed to have that.
No.
But when I say that biofilm in my side of the functional world is like the gut biofilm or the sinus biofilm, which mold and viruses and bacteria will impact people for many different reasons. So this, again, like you said, it's all connected. People that have messed up oral microbiomes,
yes, and that will impact your sinus too. That's another.
Yeah.
Sinus hygiene is really important, and it will help oral hygiene too.
Yeah.
Yeah.
All right. Tell us about this beautiful brand.
Thank you.
I mean, I recommend it to telehealth patients. We love it, but I'm so proud of you. This is so fun.
Thank you.
Because first and foremost, you're a clinician. You see, like you said, 250 patients a week.
Yeah.
But you also, because you've immersed yourself on like real people, you wanted to come up with a product that you could stand behind. So tell us about Fygg.
Yeah, thank you. Yeah, it was a labor of love. I've seen changes in the oral health care product industry, and I thought it was great, but there was room for improvement, and I felt like no one was listening. So I partnered with Dr. Mark Berhenna, who has the Ask the Dentist platform on Instagram, and we created Fygg, which is Feed Your Good Guys. The whole premise of it is to be oral microbiome supportive. So the biggest challenge in this toothpaste for us was to truly take out all the emulsifiers, surfactants, the SLS, and the SLS derivatives. So there are many companies that will not use SLS, but they'll use like a coconut-based. And we just have concerns, again, what is that doing to the microbiome? So that was the challenge. So all that stuff's taken out. Very cool. And we also took out essential oils because essential oils can be really strong antimicrobials.
Yeah, disruptive to the
people get
microbiome.
Upset by this because they love their essential oils.
Yeah, I love them too, yeah.
I think they're great for acute issues. Yeah. And so if you have periodontal disease or gingivitis, yes, maybe.
Well, like you said, every case is different. By individuality, to put a mass dose, single dose for everybody.
Exactly. Yeah. You understand. And to use it twice a day,
Yeah, right.
So,
hopefully. Hopefully twice a day, especially
right.
those Dorito flavored.
Yeah, fair. Very fair
fibers.
point. And then we added prebiotics, or a proprietary blend of prebiotics and amino acids that have been shown in the data to modulate the biofilm too.
Amazing.
And then we added in hydroxyapatite, nanohydroxyapatite specifically, because that's what the research is showing works best for cavity arrest, remineralization. And we use the only SCCS approved, which is the Scientific Committee for Consumer Safety approved nanohydroxyapatite in the world, made by Fluorinova in Portugal. So
Wonderful.
we feel really great about it.
Really exciting. And I know the science and the effectiveness is so much more important, but I'm also a sucker for good branding. You guys did a good job.
Thanks.
And it stands for
Feed Your Good Guys. Fygg.
Feed Your Good Guys.
The joke was that figs they do have prebiotics in them.
Yeah.
Yeah, we're really excited. We have comparative studies, speaking of efficacy, that are getting published as we speak and presented. And we did find that our toothpaste compares to a 5,000 parts per million fluoride toothpaste. So that's more like a prescription strength.
Amazing.
And then the varnish that we have compares to a fluoride varnish. So we are working as well as fluoride, and arguably our toothpaste works better than just a traditional Crest or Colgate.
Amazing. So right now you can get it online. Do you see yourselves being in stores? Are you?
Oh, stay tuned.
Because I see Target written all over this. You can't talk about that. No. I mean, this is going to be a Target and blow up. Let's just say that. I didn't even ask you. I don't even know. I know nothing. But I'm just assuming. I'm feeling it. All right. So let's talk about this beautiful convergence, or I would say, I don't know how to say this, but you're really partnering with IFM in a special way. So talk about this.
Yeah, thank you. So I was one of the crazy dentists that went through the IFM certification program. I remember talking to you about it actually at the summit.
Yes.
I think.
Oh, wow.
And you
That's right. You were there. In Carlsbad.
This was before you really knew me.
Yeah.
I was like a fan, and you were like, yeah, I don't know who you are. Okay. It's cool.
Am I rude in person?
No, you were totally lovely.
Yeah. Okay.
You actually hugged me. But you were not. You said, oh, don't worry about it. It's easy peasy. And I was like, it's really hard because I'm a dentist. So a lot of this was new information for me. So I went through the IFM certification program. There's only a handful of dentists in the world that have the certification. I am proud of it. I'll be really honest there.
I'm proud of you. That's amazing.
Thank you. But the thing is, I don't use all of it daily, right? We need to take the IFM training, functional medicine training, and apply it to dentistry. And so I'm working with a couple other wonderful female IFM certified dentists. So there's 3 of us involved to create the Institute for Functional Dentistry. And so we're working alongside IFM. And the idea is to get a standardized training program so that dentists can start thinking and practicing differently. Because right now, there's so many that call themselves holistic, biological, functional. That's all great. But when you actually get in their office, are they that different? And what's the standard care? Just like with your functional medicine training, there is some standardization to the labs you run and how you interpret them and protocols and things. We don't have that in dentistry. It's the wild, wild west right now. And that's not fair for patients. So we're creating a curriculum, and it will be, the first half is mostly functional medicine, which is really what we're missing as functional dentists. And the second half is now applying all that to all the specialties in functional dentistry. So it will be for all dentists and hygienists. It launches this summer, 2025. And I didn't know I knew how to create educational curriculum, but I'm figuring it out. It's like, oh.
That's so cool. It's exciting.
Thank you.
Exciting.
Yeah.
Oh, man. So they could go to functionalmedicine.org, I'm assuming, in the summertime when they're going to launch that. But.
Yes, there is a sign up now, functionaldentistry.org.
Okay. Functional.
And it's just like a little waiting list. And it's really on me to get the website launched. So I'm working on it. But
no pressure.
Yeah, it's coming. But get your name on the list, and then we'll send you everything that you need.
Functionaldentistry.org.
Yes.
Got it. My friend, this has been a blessing. Before you go, the podcast is called The Art of Being Well. At the end of every episode, we have your art of being well. What is the worst tasting food that you eat for health benefits? It tastes disgusting, but you love it for the health sciences.
Oh, man. Organ capsules, just straight up, probably.
Yeah,
or just organ meat in general.
Organ meat in general, yeah. See, organ capsules are people's like workaround because they don't like the
Yeah, they
taste.
still. I can still taste them though.
You burp it up a little bit, burp up a little pancreas.
Exactly. Yes. And that's exactly. I think that was heart. I would say that. Yeah, that would be it. That'd be my answer.
Okay, good answer. Next question: do you take any supplements? We've talked about some for dental care, but what are like 2 that are maybe out of the box that you take that you maybe not enough people know about?
Spermidine I've been playing around with. There's some studies that show it impacts dental health in a positive way too. I mean, methylene blue I've been playing around with. I kind of get out there.
I take both of those.
Yeah.
Yeah.
Great.
So we have like wheat germ extract from spermidine. It's been, for people that don't know, can you explain spermidine? It supports autophagy and...
Yeah. Well, and so in dental health, we're seeing a really improved impact on gum health too, gum support.
Great.
So,
makes sense.
Yeah. And my nails always feel so good with it.
Cool. And there are gluten-free formulas out there for people that can't have gluten. I've seen chlorella and these are extracts. They standardize it for the spermidine content. And you said methylene blue too. Yeah, we recommend both of those for when they're needed for telehealth patients. It's great.
Great.
Why do you use methylene blue for people that are new to that compound?
I just want to optimize my lifespan. ATP optimization really is what I'm looking for, targeting my mitochondrial health.
Yeah. Great. Love it. All right. Next question. What is a book that you've read? It could be fiction or nonfiction that was just, I'm getting this running Art of Being Well book club. And what should we add to the book club list?
Feelings.
I did not ask her to say that.
Breath by James Nestor, hands down.
What's it about?
It's about the lost art of breathing. The science and lost art of breathing, I believe, is the tagline. He'll kill me if I mess that up. It is one of the best books of all time. And it will explain why and why breathing matters, how you're not doing it right, what happened to humans that we stopped breathing appropriately, and how to course correct it. And he tells it in a nonfiction narrative way. He does this crazy experiment on himself. It's really wonderful. He's an excellent writer and author in human. But I think you can be doing all the things correctly, the supplementation, the diet, the resistance training, but if you're not breathing correctly and sleeping appropriately, I believe you're not going to be optimized. And so I think it's a huge part that people don't really appreciate or understand is how important breath work and breathing and airway health is.
Right. It's so foundational to everything else.
Yeah.
Yeah. What is your favorite restaurant in the world? And when you're there, what do you eat?
In the world? Well, Jason Karp's restaurant is wonderful.
True Food
Kitchen. I don't get to go there enough.
You don't have one in...
No.
Where are
Jason, what's up with that?
We don't have one here either, so I'm in the same boat.
But I know. Portland, though?
Yeah, you would expect Portland.
He has Cosmic Bliss there, though. The ice cream shop.
Good grass-fed ice cream.
What do I eat? Gosh, I haven't been there enough to remember. I remember I had a killer salad. That's all I remember.
They have some good salads, good bowls, good burgers.
I like a good steak.
They have a good grass-fed steak.
Yeah.
Okay.
I cook at home so much now.
Yeah.
I'm kind of lame that way.
Well, I don't eat out much.
Yeah.
Yeah. I'm the same way. I'm very boring. But all right, next question. What's somewhere you haven't been to that's on your bucket list to get away? Self-care.
I want to go to the Maldives, I think.
Nice. What's some place you have been to that should be on other people's list?
Oh, Acadia National Park in Maine.
I have a telehealth patient there.
Oh, you do?
Yeah. I look out of her back window.
Is she on the Atlantic?
It's beautiful. It's just lots of trees and rocks. And
it's the best.
Yeah.
It's prehistoric. It's the way life should be. Pun intended.
My friend, where do people go? Where do people go to learn about this amazing line, Fygg, your work, all the things?
Yeah. So I'm drstaci.com. It's spelled out. We'll get you the info, but that's where I have more information. I have online consultations. I have a newsletter I'm really proud of that I've kind of revamped, a weekly newsletter that I encourage everyone to check out with all these fun tidbits and more. So you can go to drstaci.com. I'm on Instagram a bit. So Dr._Staci, and I'm trying to get on YouTube and you know, all those things that we're trying to do as we grow.
It's soon to be in Target.
So, well, I did not say that. And then Fygg.com, Fygg.com is where you can get the toothpaste.
My friend, thanks for coming out.
Thank you so much. It was lovely.
Yeah.